I am Dr. Ashan Abeywardene, consultant orthopedic surgeon. I'm UK qualified and specialized in Australia in the fields of knee, hip and shoulder surgery, inclusive of minimally invasive and arthroscopic surgery. On my return to Sri Lanka, together with Durdans, I created a subspecialty center of international standards in the fields of knee, hip, shoulder and sports orthopedics. In the most severe cases of knee, hip and shoulder injuries, there is significant damage of cartilage, and the cartilage can be repaired with a technique called stem cell grafting. Stem cell grafting is a technique where stem cells, which are cells that can recreate any tissue, are taken from your own bone marrow. These are prepared as a graft and placed over the area where there is cartilage loss, so that then the cartilage will regenerate. Stem cell grafting is an arthroscopic procedure which is minimally invasive, or a keyhole procedure, whereby the patient is awake. Only the area that is operated is anesthetized. There are few to no complications, and the patient gets back to his daily routine in a couple of days.
මම ශිරෝමන් ප්‍රියන්ත ජයතුංග මම දෙමටි පිටින් නම් ආවේ. දැන්ට මම රැකියාව කරන ඕවර්සීස් වල. මම ඉතාලියේදී ප්‍රැක්ටිස් කරද්දී එකපාරට මම බෝලයක් අල්ලන්න බෝලයක් කරා හඹා යන අවස්ථාවේ ෂෝල්ඩර් එක වැදුනා. ඒ වෙලාවේ මට පොඩි කැක්කුමක් ආවා. කැක්කුම අපේලා ඒ කැක්කුම එන්න වැඩි වුණා. ශ්‍රී ලංකා ටීම් එක දැන්ට ක්‍රියාකාරී අජන්ත මල්ලි කෝල් කරා. කෝල් කරපුවාම අජන්ත මල්ලි කිව්වා මෙහෙම ડોක්ටර් කෙනෙක් ඉන්නවා අයියේ. යාට මම කෝල් කරලා වරන්නම් කියලා. ඒ ආකාරයෙන් තමයි ડોක්ටර් අෂාන් අබේවර්ධන මට හම්බුනේ. තමයි ડોක්ටර් අෂාන් මම කන්සල්ට් කරලා ඩර්ඩන් හොස්පිටල් එකේදී ડોක්ටර් අෂාන් කිව්වා ක්‍රිටිකල් තැනක තමයි තියෙන්නේ. මට යාට ස්ටිම් සෙල්ස් කියන ඔපරේෂන් ක්‍රමවේදය ඉගෙනගෙන තියෙනවා. ඒක මම කරලා බලන්නද කියලා. ඊට මම ડોක්ටර් හා කියපුවම ડોක්ටර් 2017 ස්ටිම් සෙල්ස් කියන ඔපරේෂන් එක කළා. එදායින් පටන් මම අවුරුද්දක් පාසා PRP කියන ඉන්ජෙක්ෂන් එක කරන්න එනවා. මගේ දවසෙන් දවස දැන් ඉම්ප්‍රූව්මන්ට් වැඩිලා තියෙනවා. මූව්මන්ට් සේරම වැඩි. මම තවම දැනටමත් ක්‍රිකට් ක්‍රීඩා කරනවා. ඊට අමතරව තවමත් කාර්ය වර්ධන ඒවට සහභාගී වෙනවා පොඩ. මගේ වැඩ කටයුතුත් මම සාමාන්‍ය විදිහටම කරගෙන යනවා.
I am Javier Mateo Sagasta, and I've been living in Sri Lanka for 8 years. I love sport and I love surfing. I overdid it too much surfing, and then I started having problems with my shoulder and deep pain. So I was looking for some help, and I was referred to the Durdans hospital, and then there I met Dr. Ashan, who looked at my problem and then recommended to make an MRI. The results of the MRI showed that I had two problems. So after analyzing the problem, he recommended arthroscopic surgery on my shoulder. Then they took stem cells from my hip and then re-injected them in the shoulder. This allowed to create this clot that helped the cartilage to regrow. So the surgery lasted like for 3 hours or so, and I was discharged the same very day of the operation. It was quite painful for a while, but slowly and progressively and with physiotherapy I've been progressing and improving. So my hope is that working hard with a physiotherapist for the coming 2 to 3 months, I can be fully back in business and surfing back again as I was before.
මම හිටපු ජාතික කණ්ඩායම සහ අන්ත සමාජ තරගවලට සහභාගී වුණ රග ක්‍රීඩකයෙක්. තරගවල අතරතුරදී මගේ ඇති වූ ෂෝල්ඩර් ආබාධයක් ඇති වුණා. ආබාධය අනතුරුව මම ડોක්ටර් අෂාන් වෙතට යොමු වුණා. මොකද කාලයක් තිස්සේ ડોක්ටර්ගෙන් මම ප්‍රතිකාර ලබාගෙන තියෙන සුළු ආබාධ වලට. අනතුරුව ડોක්ටර් රෙකමන්ඩ් කරා MRI එකකට යන්න වෙනවා කියලා. MRI එකේදී පෙනුණා මේ බැංකාට් රිපෙයාර් එකකට යන්න වෙනවා ෂෝල්ඩර් එක නැවතත් යථා තත්ත්වයට පත් කරන්න නම්. පැය 3ක පමණ ආර්ථ්‍රොස්කෝපි එකක් නිර්දේශ කරලා තිබුණා. අනතුරුව සර්ජරි එකෙන් පස්සේ මාස 15ක පමණ ලොන්ග් පීරියඩ් එකක් ගියා රිකවර් වෙන්න. ඔක්කොම මූව්මන්ට්ස් සමග නැවතත් මම සියලුම ක්‍රියාකාරකම් වලට පහසුවෙන් යොමු වෙලා තියෙනවා.
Hi, I'm Tirusha Jesudasan. My background was that I was Sri Lanka's one and only lady professional golfer. What happened was I put on a lot of weight and it's affected my knees. And when I came back to Sri Lanka, I just asked another surgeon and he said that Dr. Ashan, Abeywardene, he might help me in this stem surgery. So I went to meet him, and when we spoke about it, he said both knees would be needing surgery, but we'll start with the bad one, which was the right knee. And so I went ahead and he did a surgery on my right knee, and he did the surgery, and the next day they made me to walk down the hallway of the hospital, and the third day I came home. And I think within about 2 weeks that knee was okay. 6 months later I had the second surgery, and that too within the next day I came home and I was walking, and I was determined to get back to golf. Have had no problems with my knees. I continue to exercise and make sure they're okay. So here I am.
Hi, I'm Michelle Kleiss. I'm the head of school at the Overseas School of Colombo. I've been here in Sri Lanka for 3 years, and in my first year I started having knee problems, and at some point I had torn my meniscus in both my left and my right knee, dislocated my left knee, and needed stem cell injections to build the cartilage in one of my knees as well. I saw Dr. Ashan Abeywardene after I was recommended many people who have been treated by him. So I had surgery. It was really successful. He was really attentive and caring, and it was very efficient. My recovery went really smoothly, and since then I've been able to live a really active life and walk up and down all the stairs at my school and just be an active member of my own family. So thanks, Dr. Ashan. You've made a world of difference to me.
Here at Durdans, we have many therapeutic options and procedures on par with international standards to treat a wide array of joint-related injuries. However, early treatment of injuries is the better option to purely pain management and letting an injury get neglected. Most joint injuries get progressively worse with time. Therefore, it is always better to seek early treatment before the problem gets any worse.